Good afternoon, my name is Jing Xuan from Group 2, and today me and my group mates will be discussing the topic Smallpox Vaccine, Protection or Exploitation. Smallpox is a highly contagious and deadly disease caused by the variola virus, and historically, it has led to widespread mortality across human population. In this scenario, an isolated Native American community who has never been exposed to smallpox is being considered for smallpox vaccine testing. This situation presents a serious ethical dilemma. On one hand, testing the vaccine could advance scientific knowledge and potentially save life. On the other hand, it could put an unexposed population at risk, threatening their safety, rights, and welfare. To make an informed decision, we will evaluate this scenario using 4 ethical tests: the harm test, professional test, faith test, and publicity test. These tests will help us to determine whether pursuing the vaccine trial is ethically justifiable or whether protecting human rights must take precedence. The central issue in this scenario is the ethical violation involved in conducting a smallpox vaccine trial on an isolated Native American population. This community is unaware of both disease and the potential side effects of the vaccine, making the trial inherently unsafe and unethical. Such research clearly violates the core ethical principles of human experimentation. First, informed consent cannot be obtained because participants do not fully understand the risks involved. Second, the population is especially vulnerable due to their isolation and lack of access to medical knowledge, requiring greater protection rather than exploitation.
My name is Doreen Ying, and I'm going to present case study and preliminary decisions. In the Tuskegee syphilis study, researchers misled participants by informing them that they will receive free medical care for a condition, described as bad blood. In reality, even after nearly 2/3 of the men were clinically diagnosed with syphilis, they were intentionally denied effective treatment. The subjects were enrolled in the study without informed consent and were not informed of their true medical condition. As the study continued, many participants suffered severe and irreversible harm, including damage to vital organs and the nervous systems, and some ultimately died as a direct result of the lack of proper medical intervention. The several ethical violations demonstrated in this study highlighted the urgent need for stronger protections of human subjects in medical research. In response to such abuses, the World Health Organization introduced the Declaration of Helsinki, which established fundamental ethical principles for research involving human participants. These declarations promoted informed consent, risk-benefit assessment, and respect for patients' autonomy, leading to the formation of institutional review boards (IRBs) and the significant reforms in medical education and research ethics. For preliminary divisions, before applying formal ethical evaluation frameworks, our initial position is to oppose testing the vaccine on an isolated population, as such communities are particularly vulnerable to exploitations and may face limitations in fully informed consent.
My name is Ke Yuh, and I will present a harm test analysis on the issue of conducting vaccine testing on Native American or isolated populations. There are 2 options in this case. Option 1 is agreeing to conduct the vaccine testing, while option 2 is disagreeing. Under option 1, the population may benefit if the vaccine is effective, but it does a risk of severe side effects. Ethically, testing is only acceptable with proper informed consent. Otherwise, there is a risk of exploitation. From a public health perspective, this option may support national vaccine development, but biased or unreliable data could cause wider harm. In terms of social trust, ethical research may build trust, but any harm or lack of consent could result in public backlash. Legally, while this option may advance medical policy, it also carries legal risks if consent is not properly obtained. Under option 2, the Native American population avoids the risks associated with experimental vaccines can receive immunity through vaccines that have already been tested and proven safe. This option protects their autonomy, cultural values, and ethical rights. However, they may not participate in national health research initiatives.
My name is Siau Sian, and I'm going to continue explaining the harm test. From the perspective of researcher and scientists, agreeing to conduct the vaccine testing provides opportunities to gain valuable scientific data, contribute to medical knowledge, and support career advancement. However, this approach also carries the risk of biased data collection. If harm occurs during the study, it may lead to serious ethical consequences, loss of credibility within the scientific community, and damage to personal image. In contrast, disagreeing to conduct the vaccine testing may result in the loss of potential breakthrough data and scientific advancement. Meanwhile, for the wider society and the public, agreeing to the vaccine testing may lead to the development of a potentially better vaccine that can improve disease prevention and reduce the risk of future outbreaks. At the same time, there may be no change to the current level of immunity, and biased data could increase the risk of potential side effects. From an ethical perspective, this raises concerns about possible exploration.
My name is Chen Xi, and I will be presenting the faith test on this dilemma. It is conducted based on the four main religions in Malaysia: Islam, Buddhism, Hinduism, and Christianity. First, the Islamic faith rule states that no one is entitled to dispose the rights of a human being without his permission. Applying this rule in the context of scientific research, the vaccine should not be administered because no one should be involuntarily involved in a research project without free, voluntary, and informed consent. Buddhism commits to 5 basic moral rules: not to destroy life, not to steal, not to engage in sexual misconduct, not to tell falsehoods, and not to take intoxicants that can cause careless behavior. Buddhist views don't support vaccine administration as a priorly untested vaccine risks damage and side effects to the human subjects. The Mahabharata in Hinduism states that a man should never engage in the doing of anything that brings pain to others. An untested vaccine cannot guarantee a common good, so vaccine administration is not supported by Hinduism. The phrase, "love your neighbor as yourself," is one of the greatest commandments in the Bible. Christianity does not support vaccine administration because to rob the human being of his freedom to decide about his health and body enslaves one's neighbor and deprives him of the moral merit to consciously help science and humankind.
I'm Kamaliya Rahman, so right now I'll do the one who explain the provisional test. So when conducting vaccine research involving indigenous communities, researchers must place participant safety at the forefront. According to the Declaration of Helsinki, the benefits of the research must clearly outweigh any risks, and vulnerable groups should only be included when the study directly addresses their specific health needs, excluding indigenous peoples when they could benefit might worsen existing health inequalities, so their inclusion must be carefully justified. The ICH Good Clinical Practice Guideline emphasizes that participants' rights, safety, and well-being always come first. Informed consent is essential. It must be fully voluntary, clearly understood, and not only consider the individuals but also respect community decision-making tradition. The UN Declaration on the Rights of Indigenous People, UNDRIP, further highlights that indigenous communities have the rights to participate in decisions affecting them, access the highest attainable standard of health, and maintain control over their cultural knowledge and biological resources. This means research must respect their rights to manage their own data and resources, ensuring cultural and ethical sensitivity throughout the study.
My name is Murugan, so I will be explaining for the publicity test. For the publicity test, we ask simple question on how would the public react if the decision was made. If vaccine testing were conducted on an isolation Native American community, it would likely be viewed very negatively. This is because such community often have limited access to medical information, which increase the risk of misunderstanding, lack of informed consent, and possible exploitation. From the public's perspective, testing a vaccine on a vulnerable and isolated group could appear unethical and unfair. Additionally, smallpox vaccines have already been developed and improved over time. Choosing to test a potentially risky vaccine on an unexposed community could raise a strong criticism, as it may be seen unnecessary and harmful rather than protective. On the other hand, disagreeing with vaccine testing on this group aligns with core bioethical principles such as respect for the person, autonomy, beneficence, and justice. The public would likely support a decision that protects the right, dignity, and safety of the community.
Based on the case study and ethical analysis, we have decided not to support testing the vaccine on an isolated population. Clinical trials raise important ethical concerns, including informed consent, the use of placeballs, consideration for children and pregnant women, post-trial access, and ensuring vaccines are safe, effective, and affordable. It's crucial that trials carefully weigh potential risks and benefits to maintain a balance between compassion and scientific advancement.
Before we conclude, we would like to express our sincere gratitude to DR.Zuwairi for his guidance, clear instructions, and continuous moral support throughout this project. We also thank the University of Malaya for providing the necessary resources and a conducive environment to carry out this work. Lastly, we sincerely appreciate all team members who dedicate their time and effort to the completion of this project. Thank you.